Hi, and welcome to today's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know about the most common health conditions listed from A to Z in 5 minutes or less. And today's topic starts with the letter D. So let's talk about diarrhea. What is it? Diarrhea is a condition that affects your bowel movements or your stools that causes it to become very loose or watery. It's actually a condition that can be very common, and many people can get it multiple times per year. It usually lasts about 2 to 3 days, and the good news is it's not usually a serious condition. What are the symptoms? The most common symptom of diarrhea is, of course, having watery stools. If you have thin or loose stools, this can also be considered a form of diarrhea. Some people may also experience abdominal cramps or bloating, a feeling of urgency to have a bowel movement, or also nausea or vomiting can sometimes be associated with diarrhea. More serious symptoms of diarrhea may include blood or mucus in your stool, weight loss, or fever. Diarrhea can also lead to dehydration if you are having more than 3 watery stools per day and not drinking enough fluids. What is the cause? One of the most common causes of diarrhea is due to a viral infection. Sometimes it is referred to as an intestinal flu or a stomach flu. Other causes may include just eating foods that upset your stomach, or having allergies to certain foods, alcohol abuse, diabetes, diseases of the intestines such as Crohn's disease or ulcerative colitis, a bacterial infection that leads to food poisoning, overactive thyroid, laxative abuse, certain medications, radiation therapy, some cancers, surgery on your digestive system, malabsorption, which is your body's inability to absorb certain nutrients, and finally, sometimes running can lead to diarrhea, known as runner's diarrhea. Another major cause of diarrhea may include irritable bowel syndrome. This is a syndrome where you can have either constipation or diarrhea or both. When should you see your doctor? If your diarrhea is lasting longer than 2 days, if you have a fever associated with the diarrhea, or if you are having black or tarry stools that contains blood. You will also want to see your doctor if you are experiencing severe abdominal pain, or you are having nausea and vomiting that doesn't allow you to drink enough fluids to replace the amount that you lost, leading to severe dehydration. Signs of dehydration may include dark urine, less urine than normal, rapid heart rate, dry skin, headaches, or confusion. And lastly, if you experience diarrhea for more than a week after returning from a foreign country, you will also want to see your doctor. Diagnosis. When seeing your doctor for concerns for diarrhea, your doctor is going to ask you certain questions. They will get your medical history, what medications you are on, and ask what you have had to eat or drink recently. They will ask you the type of stools you are having and how long you have had it. Also about any of those signs of concerns we talked about, such as blood or mucus in the stool. On physical exam, they will look for signs of dehydration and make sure you don't have any abdominal pain. And if indicated, a helpful tool to diagnose diarrhea may be a stool study where they can look for bacterial or parasite causes of diarrhea. If your doctor is concerned about a more serious cause of your diarrhea, they may include a blood test to look for certain diseases, or even possibly a colonoscopy, which will give your doctor a visual picture of the health of your colon. What is the treatment? In the case of mild diarrhea, you may not need any treatment. As long as you stay hydrated, it should go away within 2 to 3 days. If it is affecting your daily life, there is a medication you can take called loperamide. You can get it over the counter, and it works by just slowing the process of diarrhea. If you are having frequent episodes of watery stools, you want to make sure that you are staying well hydrated. So you want to be drinking plenty of water, up to 8 glasses a day. Avoid soda with caffeine. You can also drink sports drinks as they have electrolyte replacements within them. And be sure to drink plenty of fluids between meals and not just during meals. Frequent diarrhea may also lead to irritation in the rectal area. If this occurs, you can treat it by taking a warm bath, keeping the area clean and dry, and applying Vaseline or petroleum jelly. As a family medicine doctor who has treated many patients with diarrhea, I would like to reassure you that the majority of cases are mild and will resolve on their own. Like we talked about, the most common cause of diarrhea is likely a viral infection. However, I have seen a lot of cases related to food or food poisoning. If your symptoms are lasting longer than a week, it could be a bacteria that is causing your diarrhea, and for that you would want to see your doctor for antibiotics. I know it's not the most fun or pleasant condition to have, but I hope this information has helped today. And that wraps up our discussion on diarrhea. If you have any more questions, please let me know in the comments section. I would be happy to answer them for you. If you would like to see more educational videos like this one on the most common health conditions listed from A to Z, be sure to subscribe as I am posting these videos every Friday, and I will see you on the next video. Until next time, bye!